Hi, I'm Dr. Devayani Barve. I'm a plastic surgeon practicing in Mumbai. Today, I'm going to talk a bit about breast implants and when are they done. In my previous video, I had spoken a little bit about this topic, but today's video is going to be in detail. Which are the different types of breast implants we see in our practice today? There are saline implants and there are silicone implants. Breast implant surgery is mainly done for those patients who are seeking an increase in their size or volume of the breast. However, it can also be used to modify the shape of the breast in a certain way. So patients who are born with small cup sizes or flat chests, breast implants can be used to increase the cup size, maybe 2 or 3 cups also. And patients sometimes who have underdeveloped breasts on one side or asymmetry, the implant can be used only on one side to correct the symmetry of the breasts. There is no real age limit for this surgery and it can be done at any time after one becomes an adult. Now let's talk about the procedure a little bit. Breast implant surgery is a simple procedure which is done over a period of 1 to 1.5 hours, and it can be done as a daycare procedure in which the patient goes home the same day. The recovery takes about 2 to 3 days and most activities can be resumed within 10 to 14 days. As a patient, you will need to wear a support bra or a sports bra for a period of 6 weeks. Earlier, there used to be different ways in which the implants were inserted. Some used an incision in the armpit, some used an incision in the belly button, some have also used an incision around the areola of the breast. But most commonly, and now the preferred technique, is the one in which a cut is made under the breast such that it hides in the fold of the breast. This is the safest way of doing breast implant augmentation and the incision stays concealed. Most of the patients are not at all bothered by this cut and it does not even become an issue in the future. During the surgery, the surgeon has to make a choice as to whether to place the implant directly behind the breast or to go one step below and place it behind the muscle of the chest wall. Again, this decision will depend on the body of the patient and what are the expectations from the result. Implants, as I mentioned, are of 2 types, saline and silicone. Saline implants are those which come with an outward shell, and saline or water has to be injected inside to inflate them to achieve a certain size. The problem with this is that some amount of water can leak out with normal bodily movements such as running, jumping, jogging, and the breasts can start looking asymmetric. Also, sometimes the shell of the implant can start showing through from under the skin, which is called as rippling. A silicone implant, on the other hand, the implants which we get nowadays are highly cohesive gel implants which hold their shape and form. So for example, these are a few implants which I have, which are silicone implants. These implants are highly durable. Nothing happens to them even if I squeeze them, crush them, do whatever. And if I were to cut the implant in half, I will have 2 pieces in my hand. So there is no risk of rupture, gel leak, problems happening because of the silicone interacting with the breast. All these things don't happen anymore. So the 5th generation or the latest generation of silicone implants are very safe and they are tolerated perfectly by the body because they are inert, which means the body does not react to them. Now, what are the problems which can happen after a breast implant surgery? The most common issues which we see with any surgical procedure, such as infection or some amount of bleeding, can also happen with this procedure, but the chances of it happening is very, very low because we take the utmost precautions to make sure that these don't happen. Problems specific to a breast implant procedure can include a capsular contracture or a seroma. Now, what is a capsular contracture? This is an implant. When it's put in the body automatically forms a protective layer around it, which is called a biofilm. This, when it becomes thick in very rare patient group, that's when it forms a hard contracture and something may need to be done about. But the percentage again is low. So regular checkups are required every 3 years or so to make sure that nothing is going wrong with your implant. The other issue which I spoke about is a seroma. Again, it is a reaction of your body to the implant being there, and it can just be a little bit of fluid collection around the implant, which can sometimes cause a little pain. Apart from this, there are no real long-term complications or side effects or anything which happens with implants, and most patients are very happy with their procedure, which can last as long as 15 to 25 years. Most commonly, patients come back to me for a change of implant or a removal of implant when they feel that their bodies have changed too much such that the implant doesn't suit them anymore. They may have lost a lot of weight or they may have put on a lot of weight, or they just feel that their breasts feel heavy now and they don't want to do it anymore. So apart from this, Most patients live happily with their implants, and I have had patients who have been 60, 65 years and they have had their implants for 40 plus years. So implants overall is a very safe procedure. So 2 questions which patients commonly ask me about are: 1, if I get these implants done, will my partner or my friends come to know about it? Well, generally if you have a good breast volume and if you get a moderate sized implant behind it, nobody is going to come to know, because the feel and the touch of the implant and the breast overlying it stays completely normal. It's just that the size increases. On closer inspection, however, a small scar can be seen because it's not magic and scars don't disappear. However, just by the look and feel of it, nobody can make out that you've had an implant. The second question, which a lot of concerned patients do ask me about, is that are breast implants associated with cancer? So to set things straight, breast implants do not cause breast cancer. Having said that as a broad statement, there is one small entity which I would like to inform everybody about. ALCL is a type of condition which has been seen with some kinds of breast implants. This is not a cancer. However, it does cause some changes in the body and around the breast implant. It can cause swelling of the breast, some fluid collection, pain, redness, generally more than 6 to 7 years after the surgery has been performed. So rather than getting alarmed by it, it is important to get regular checkups done and make sure that everything is in order. And secondly, a heartening thing to note, as the implants which were directly found associated with this kind of condition were banned. So the implants which we are using now have not shown a direct relation. Despite all this, it is important to be cautious, and that's why always get a regular checkup done. Also, breast implant surgery does not change your day-to-day life in any way. You can still continue to run, jog, cook, fly overseas, go diving, whatever it is you want to do. There is no risk involved because you've had a breast implant. So to summarize, this is a very safe procedure which gives almost immediate results and has far-reaching effects on somebody's self-image and self-esteem. So if you found this video beneficial, please don't forget to like it and do share it with someone who you think may benefit from it. Please don't forget to subscribe to my channel, and thank you for watching.